Good evening, Peter Goertz. I'm a psychiatrist. If you're a medical student or a doctor, you're going to be used to memorizing a whole lot of facts, and you can use what I'm going to talk about now on the side. Like if you're shaving or getting dressed in the morning or driving in your car, you can learn some facts by listening to this video. So here are some facts that I've found useful over the years for exams, for example, but also for daily practice at times. And these are facts pertaining to neurology. As a psychiatrist, you're going to have to memorize a good amount of facts of neurology, both for the exam, the board exam, and also in practice, you're going to have to know a good amount of neurology. So here we go. GABA, glycine, and taurine are inhibitory amino acid neurotransmitters. Glutamate and aspartate are excitatory amino acid neurotransmitters. The locus coeruleus is associated with norepinephrine, the Raphe nuclei with serotonin. If someone has attempted suicide, there can be low CSF5-HIAA. The substantia nigra is associated with dopamine. Tyrosine hydroxylase is the rate-limiting step in dopamine synthesis. The dopamine pathways are mesocortical, mesolimbic, nigrostriatal, and tuberoinfundibular. Dopamine inhibits the synthesis and the release of prolactin. The nucleus basalis of Meinert is associated with acetylcholine. Conduction aphasia is associated with the arcuate fasciculus and with impaired repetition. In transcortical aphasia, repetition is intact. Wernicke's aphasia is associated with paraphasic errors. Alexia without agraphia is associated with the left occipital area and the posterior corpus callosum. Balance syndrome involves optic ataxia, visual apraxia, and simultanagnosia, and it's associated with bilateral parieto-occipital lesions. Anton syndrome is associated with cortical blindness, confabulation, and that involves bilateral occipital lesions. In petit mal or absent seizures, you have 3 per second spike and wave complexes on EEG. And it begins around age 7. In 2/3 of patients, it disappears in early adulthood. In 1/3, tonic-clonic seizures can replace the absences. Absence seizures are more common in girls. And treatment for absence seizures or petit mal seizures consists of ethosuximide, valproic acid, or lamotrigine. Hypoglycemia and hyperventilation can provoke absence seizures. In atypical absence seizures, you have 2 per second spike and wave complexes. They last minutes and are associated with loss of postural tone. In hepatic uremic encephalopathy, you have asterixis and triphasic waves on the EEG. Central pontine myelinolysis can be due to, it's also called osmotic demyelination syndrome, and it can be due to correcting hyponatremia too rapidly. It can also be caused by too rapid rewarming in hypothermia. Acute intermittent porphyria is autosomal dominant. involves chromosome 11 and a deficiency of porphobilinogen deaminase. It involves abdominal pain, psychosis, and neuropathy, and you have high delta-aminolevulinic acid and porphobilinogen in the urine. Mitochondrial DNA is inherited only from the mother. Fascinating to me. It's double-stranded, ring-shaped, and is associated with 37 genes. In mitochondrial encephalopathy with ragged red fibers, so MERF, M-E-R-R-F, you have lipomas, optic atrophy, deafness, short stature, myopathy, and neuropathy. In Wilson's, you have hepatolenticular degeneration, you have autosomal recessive inheritance. It involves chromosome 13 and the gene for copper transporting ATPase. It's associated with dysarthria, so this is Wilson's, with dysarthria, dystonia, dysdiadochokinesia, drooling, a wing-beating tremor, Kaiser-Fleischer rings, sunflower cataracts, and what is called a rhizus sardonicus, a certain smile. Wilson's involves low serum ceruloplasmin and copper, high urinary copper excretion, and on MRI, you get what is called the face of the giant panda. So that can be helpful on exams. Treatment of Wilson's involves chelation with D-penicillamine, ammonium tetrathiomolybdate, zinc, and triethylene tetramine dihydrochloride. The striatum consists of caudate, putamen, so both caudate and the putamen. The lenticular nucleus consists of the globus pallidus and the putamen. D-dopa does not cross the blood-brain barrier. And I think that's probably enough facts for today. So enjoy learning. And I've found over time that listening to things while I'm doing something else, like whether it's eating breakfast or driving the car, listening to facts like I just read to you to memorize can help you a lot on exams because you learn without really trying. Thank you.